Hello and welcome to Wellness Wednesday. I'm James Currie with the Communication Department here at MCHD. I'm talking to Larry Durant. He is an outreach educator with our OD2A program. That's Outreach Data to Action is what that stands for. Larry, thank you for being on Wellness Wednesday.
Thank you for having me. I'm happy to be here.
Now, you and I are talking because October, let me look at my notes here, make sure I get this right. October is National Substance Abuse Prevention Month. And just tell me a little bit about what that month is.
Well, it's the month that we normally celebrate and honor those individuals who are on the front line to assist us with honoring people who are in recovery, them, their families, the community. We want to let them know that despite the fact that there really isn't any recognition on a larger scale, that we appreciate them and all that they do in this fight against substance and substance abuse disorders. That's pretty much it.
Mm-hmm. And, I mean, it's not just one month of the year that we're, looking at this issue at the health department. It's just that's the month that is, designated as awareness, but still the other 11 months of the year, you are still on the front lines there and you are, out there in the public. So
Yes.
let me look at my stats here. I've got some stats here that maybe you can expand on a little bit. And these are from the National Center of Drug Abuse. 50% of people 12 and older have used illicit drugs at least once.
Yes.
Wow.
Yeah.
Yeah, and then 700,000 drug overdose deaths in the U.S. since the year 2000, and now we're nearing 1 million drug overdose deaths.
That's correct.
Wow. And then the government, they have set aside some money also to combat this issue. Do you have, what kind of budget they're working with?
Yeah, James, is approximately about $35 billion. That's billion, because believe it or not, just last week, I spent an entire week in one of the schools in the school system here in Mobile that is a middle school. And every day I sat in those classes for 4 days and talked to 6th, 7th, and 8th graders. I pretty much was trying to educate them on the woes of drugs and alcohol, even tobacco, which we have a program called SWAT for that. But you would be surprised at the number of individuals who, after letting them know that I was not the police, that they raised their hands when I polled them as to how many had a beer the previous weekend or smoked marijuana or even vaped. And the numbers were staggering. Almost half of the students are using. And this is what I'm trying to deter. I want to try and help them before it becomes too late.
Right, and that's, excuse me, that's a problem. I mean,
Yes.
you're talking to kids in school. They're not old enough to drive, but
No.
they've got accessibility to these items. So do we have like a general idea as to, or did they share with you as to how they're, getting their access or getting hands on these items?
Well, believe it or not, as oddly as it might sound, some of these children, and I say children, are using with their parents. Some parents are actually dealers, or the dealers are visiting their homes and the children have permission to use drugs, alcohol, you name it. Despite the fact that I gave them some information, especially regarding the young lady from Mary G. Montgomery that passed away because of fentanyl, not very many of them were aware, but there were some students. As a matter of fact, my last day, one young lady said that she knew the person that passed away. So in answer to your question, James, they have easy access to these drugs. And it's sad to admit that the reason they have it is because of their parents or the lack of parents.
Wow. So that's a whole other topic right there
Yes.
to himself.
Hmm.
We'll have to readdress that later, maybe at a different level. But
Hmm.
yeah, we've talked to, or I've talked to here on Wellness Wednesday, other behavioral health professionals, and they said that, you know, a lot of this stuff, like you just kind of reaffirmed, it begins in
Hmm.
the home.
Yes,
That's where, you form all of your, social skills of how things are, how life is, or how you live life, how you do life. It begins
absolutely.
in the home, and that's troubling to hear that is beginning in the home.
Yes. Hmm.
So, like we mentioned, you are an outreach educator. Like you mentioned, you go out to the schools. So what other
Hmm.
roles do you have as an outreach educator?
Well, in addition to trying to get the message out to the schools, I also follow up on data that we receive whenever there's an increase in emergency calls to report overdose episodes. In essence, when I first started back in May, I was going out to areas where certain zip codes were identified. And I would set up my booth and I would try and talk to individuals within that community to make them aware of the epidemic. And ironically, there's this one place where I set up right next to a store in the neighborhood that's out in the West area. And a young lady came up to me and said, if only I were there the week before, we may have been able to help her friend who died from an overdose. So I get that information from my supervisor, Danielle Simpson, and I think she was here last week, and she provides that information to all of us on her team. And so once we get that information, we try to go into the community where it appears to be a hot spot and provide education to let people know that these drugs today are really, really deadly, especially fentanyl when it's produced illegally.
Yeah, so let's go back to OD2A. What we already established what that stood for. So,
Mhm.
you're gleaning a lot of data, a lot of information,
Yes.
demographics, statistics, just real-time traffic,
Mhm.
that you're going back and analyzing, and then that helps you do your job to
Yes.
know where you need to go into the community.
Mhm.
Now, you know, that's us going out to the community, but now the community can come to us. They can
Mhm.
contact us. So
Yes.
if you can provide that hotline, I know that there is
Mhm.
a OD2A hotline number.
Yes. And that number is 251-410-6322. That's 251 OD2 Data to Action.
OD2A. Yep.
LD2A.
Yeah.
Yes.
Yeah. 410-632-2251 area code. And also, information on your program can be found on our website, mchd.org, just
Yes.
by searching OD2A and
Mhm.
checking and following us through social media, to be able to find out a little bit more information too on your program and the other Wellness Wednesday episodes that we've had dealing with OD2A and the results of your program. Larry,
Mhm.
is there anything else you'd like to add about your job and, your passion for the job and, a success story or anything like that?
Well, I too am a person in long-term recovery. I have 19 years clean. I'm very proud of it. But more importantly, I want to kind of plug this little booklet. It's called Hope. We have this in our office, and it has a lot of different resources that can be provided for those who are still struggling with drug abuse or drug abuse misuse or disorder. I'm trying to get it out. But the bottom line is that there are resources to help individuals that's still out there. And you're right, they can come to us. We're located in Building 4 on this campus. And I want everyone to know just how important it is to us to try and reach out to help But if you really, really have gotten to the point where you have decided you reached your bottom, we're here to help you.
Well, I appreciate that, Larry. And Larry, congratulations also too on your recovery. And we support you wholeheartedly. So um, what a great testimony. Thank you very much for being on Wellness Wednesday and sharing that information with those that follow us and view us here on social media. So thank you again for, like I said, just being here and
Yes.
I'm just still trying to take that in. It's still kind of overwhelming about the information that you hear when you go into the school. So,
Yeah.
um, you know, I support your program wholeheartedly, and it's an uphill battle, and it takes a
Yes, it is.
special person to be able to do that. And we're so thankful that you're here on staff at
Absolutely.
MCHD. Well, thank you again.
Thank you. Thank you very much, James.